Hello, today we will discuss seminal fluid analysis. So, what are the fluid fractions present in the seminal fluid? They are derived from seminal vesicles, prostate, testis, and urethral glands. So, from the seminal vesicles, there is a viscous yellowish secretion which is rich in fructose, vitamin C, prostaglandin, and they help to nourish the sperm. The main role of seminal vesicles is in contribution of fructose which helps in nourishing the sperm, and second is prostate. Now prostate helps in activating the sperm as its secretion, which is milky and acidic. It contains acid phosphatase and various proteolytic enzymes. Testis produces the sperms, and urethral glands, they contribute very less, as they're very small mucus secreting glands, and their secretion is also known as pre-seminal fluid. Now going to the sperm transport. So we know that sperms are produced in the testis. They are transported from the testis to the epididymis. Here they mature and they acquire the ability to swim, and then they move to the vas deferens. They are stored, and at ejaculation the sperms are transported out of the vas and they mix with the accessory gland secretion like prostate and seminal fluid, as we discussed earlier. Now normal spermatozoon is about 70 micrometers long. There are three parts: there's head, there is midpiece, and there is tail. And the head contains haploid set of chromosomes, that are 23 chromosomes. Now going to what is the purpose of doing seminal fluid analysis. So firstly, it is used in investigation of fertility. It is used after any treatment, like after vasectomy, to see whether the procedure was successful, to see the suitability of the semen for artificial insemination or IVF. Now how we will collect the sample. The patient or the person is instructed to collect the semen after 3 days of abstinence. Around 3 to 5 days of abstinence is standardized, because if there is longer period of abstinence, it leads to higher semen volume but reduced sperm motility. If such a case is there, if such a patient is there where there is longer period of abstinence, we go for a second semen specimen which is collected 2 hours after the first sample. Now the bladder should be evacuated prior to the ejaculation, because there are chances of retrograde ejaculation, and if retrograde ejaculation is suspected, a post ejaculate urine sample must be collected. Now the two specimens should be collected for the reporting. They should be collected within 2 to 3 week interval, and if they are markedly different from each other, then we can collect another specimen. Ideally, these specimens, where should they collected? They should be collected adjacent to the laboratory. Firstly, it makes easier for the doctor to evaluate the sample as soon as possible. And secondly, some samples, like for when we are going for IVF, the sperms needed to be separated from the seminal fluid as soon as possible. So the specimen should be collected into pre-warmed, sterile, non-toxic, wide-mouthed container with a screw top, and it should be noted that they are not collected in condoms, as there are spermicidal agents present. And it is also important that contamination of the semen sample with either soap or water, this will affect the sperm quality. The sample now should be kept at 37 degrees Celsius until the analysis is done, and analysis should begin ideally within 30 minutes of the ejaculation. Now the semen specimen is collected, but we should know that it contains dangerous infectious agents like HIV, hepatitis viruses, herpes simplex, so should be handled as a biohazard. Now the methods of collection. So the methods of collection are masturbation, coitus interruptus, and epididymal extraction. The first one, masturbation, is the method of choice. Now we are going for the macroscopic examination. After 20 to 30 minutes after the semen has been liquefied, we will understand what is the meaning of liquefaction. After 20 to 30 minutes, we will examine the semen. The parameters noted here are appearance of the specimen, odor, liquefaction time, volume, viscosity, and pH. Now going to the appearance. Normally it is grey white in color and has a translucent musty odor, but it can have a yellowish hue which is present in panspermia. It can have a rust color if there are presence of small bleedings. Then going to the liquefaction time. Normally the seminal secretions gradually liquefies in 20 to 30 minutes, and it is due to the prostate. The prostatic fluid which was added has enzymes like acid phosphatase, and it liquefies the gel portion of the seminal plasma. If there is failure to liquefy, we know where the problem is, that is, there is inadequate prostate secretion. Now going to the semen viscosity. After liquefaction, the viscosity of the sample can be estimated. How? It can be estimated by taking it into a wide bore pipette and allowing the semen to drop by gravity, and then we will observe the length of any thread. A normal sample, it leaves the pipette in discrete drop, but if the viscosity is abnormal, the drop will form a thread which is more than 2 centimeter long. Now going to the volume of the specimen. The volume is mostly within 1.5 to 5. WHO says if it is more than 1.5 ml, it is normal, and it can be measured by weighing the cup before and after the specimen collection. Now WHO says, I have told you that should be more than 1.5. If there is low semen specimen, it indicates there is partial or there is complete blockage of the seminal vesicles. The pH, it should be slightly alkaline, slightly on the alkaline side, that is 7.2 to 8. pH is important as the sperms they die at the pH less than 6.9. pH of more than 8 is due to acute infection in prostate, seminal vesicle, and epididymis, and pH of less than 7 occurs if there is contamination with urine, if there is obstruction, and if the specimen consists mainly of the prostatic fluid. Now we know that pH is measured using pH strips, and you submerge the pH strip in aqueous solution, and then you compare the color of the pH strip with the color of the packaging that the pH strips came in. Then going to the semen biochemistry, we will discuss semen biochemistry, microscopy of the semen specimen, and various other details like Kruger, strict criteria. This we will discuss in next video. Please like and subscribe to my channel for more videos like this. Thank you.